And welcome back. We are in 59 minutes. I'm having a discussion with the CEO, KMTC, that's the Kenya Medical Training College, Professor Michael KIPTOO. He's taking us through the motions of what they offer out there and, giving a path to those of you that may not have qualified for university on how you can become a medical practitioner, can become a nurse, a clinical officer, even become a doctor. And I really appreciate what we are talking about, Prof. Tell me, what is the path? Because, a lot of us are, we want to know how will we end up eventually at the university. Okay. How can I take a path through KMTC and still end up in university and still do, go to the highest levels of the medical career?
Thank you very much. For prospective students, there's an opportunity. If your dream was to become a nurse, paramedic, clinical officer, or a medical laboratory scientist, there is room. You want to be a pharmacist, you want to be health records, you want to be a radiologist, name it. We have all the programs. And you can start with a basic certificate and progress. Because the opportunities we provide is that, as I mentioned earlier, if you have a C-, you qualify for a certificate. So you can start with a certificate. When you finish your certificate course, we will give you an opportunity to pursue a diploma. If you are successful enough and you finish the diploma, you have two ways. One, you can go to the university directly and pursue, let us take the example of nursing. You can go to the university directly and pursue a course at the university where you may even get some credit exemption. And you can do a Bachelor of Science in nursing. You can move and do a higher diploma with us, and then you go again pursue the BSc, which you may get more credit waivers at the university. So you'll still finish with a Bachelor of Science in nursing. And that is not the end. The sky is the limit, depending on the ambition that you need. You can choose to practice at that level and pursue a master's in nursing, depending on what you want to do. The university will also give you a leeway. You can still have done that program, but you can still pursue a master's in epidemiology, depending on your strength in terms of the courses that you undertook. If you're good enough, you can pursue a PhD. Already you have gone to the highest level in terms of academia. For those who have done clinical medicine at diploma level, you can go to the university. You do now a bachelor's in clinical medicine. And the moment you have done that, you can go and pursue your degree. And if you compare those who go directly to the university to undertake medicine, a bachelor's in medicine and surgery, and those people who have done a diploma in medicine and surgery, they're equally the same. So you still have achieved what you wanted in terms of your career path without losing anything in the middle. The only thing that you'll have to be patient is that you may take slightly more years than the person who has gone directly to pursue.
It's like the longer route, but the destination is still the same.
Of course, destination is still the same. And you can even now decide, if you don't want to practice, you can join the university and teach. You can come back to KMTC, and we have quite a number of lecturers who are alumni of KMTC. So the sky is not the limit. There are opportunities. So I want to urge the youth that if your passion was to do medicine, there's an opportunity. And there are many programs. I've mentioned earlier, it is 83, and you can visit our website. You can see all those programs. The other thing that I've done is to ensure that the admissions have been decentralized. So I'll urge guardians and parents that visit the nearest KMTC to you. We're already in 43 counties. You will be given more advice if you need it, because it depends on terms of what the person wants, what are the qualifications, do you meet the criteria to do certain course. If you don't meet this criteria, we'll tell you can do this. We do also offer courses like medical engineering. We have radiology. We have courses like optometry, which are required. But maybe most people do not understand that we do have those courses. We have health records and information technology. And if we are talking of universal health coverage, we need people who will be able to work at the community. We do also have a department, a whole department on community health. And these are the people who will be able to ensure that we achieve UAC come next year. We are already in partnership with the Ministry of Health and AMREF, and we are training specifically to support UHC. We are also working very closely with the National Youth Service, so that when they finish their training, those who are interested in medical courses have joined KMTC, and especially in the areas of community health. And these are the people who will be able now to actualize the prevention at that community level. Because for us to succeed in UHC, we need to have that proper linkage from the household to the nearest facility. And if we have data being collected at the household, that will inform the level 1 facilities who now move to level 2 and 3. And that will ensure that we decongest the level 6. Because what happens is that we don't have the right information. Even here in Nairobi, people just want to go to Kenyatta, whereas we have good facilities in Bagade and others, Mama Lucy and so on. But we all just rush to Kenyatta National Hospital. So if we have a proper referral systems and we train the right cadre of people from community level as they come up, as they specialize, can tell you, we will manage and ensure that we prevent most of the diseases.
Yeah, that's right. Now, how important, and let me ask you, Prof, is passion? Like if I'm trying to come to do a particular, is it a factor that I be passionate, or should I just be qualified for?
To me,
what would you say?
Thank you for that, Connors. To me, what is important is first, you need to qualify. You know, sometimes you ask yourself, what is passion? Is there a passionometer that you want to measure? It is not there. So the important thing is your qualification and the dream that drives you. If you ask most of the people in their careers, did you ever thought of being a doctor? Some will tell you, yes, I had some thoughts. Some will say, I qualified, and when I qualified, I said, oh, I've qualified for medicine. Let me go for it.
Because young people nowadays say, you know, sina passion ya hiyo kitu.
So, it is an issue of, you must accept first that this is where I want to go. We have seen people coming and dropping out because of the fact that the moment you take them to anatomy or pathology lab, now when you want to do the real medicine, they say, oh, this is not for me.
True.
Other people will go through, but they are very few. And the other thing that drives is for me, I'll say more is satisfaction rather than passion. If you are really satisfied that this is what I want to do, this is what I want to deliver, when you see that you have saved a life.
So you want to give a service.
You want to give a service.
Yeah.
Let me tell you, we have lost a lot of doctors because of the current pandemic we are dealing with, COVID-19. This has happened because they wanted to save lives. They wanted to give a service. And we have lost the soldiers. It's just like being in the military. We want to protect the country. And for you to protect your own country, there is...
You can end up taking a bullet.
You can end up taking a bullet. So the same thing that has happened in the medical field also, you can be exposed because of the nature of the works that we do. So that put all together, it is what you get satisfied doing. Because at the end of the day, we cannot all be journalists, we cannot all be doctors. We need everybody.
We need a guy in the lab.
We need a guy in the lab.
Tell us you have malaria. Or
you have this proper diagnosis.
Yes.
And that's why we keep on talking of evidence-based medicine. And that's why we have these 83 programs, so that we can train all the cadres who will now work jointly to ensure that we provide the right service to the patient. For instance, if you visit a health facility, try it, you have a nurse who will take temperatures and so on. Somebody, phlebotomist who has specialized in just getting draws blood is required. After that, there's a laboratory technician who will now look into that. Look that, okay, what I'm seeing, the organisms that are causing the disease are this. And then now the doctor will prescribe. We have a farm tech
who must give the right dosage.
Must give the right dosage. So you can see it's an array of cadres who work jointly to ensure that at the end of the day, me and you and any other person who requires health care receives the right medication.
So it's actually a big conveyor belt. You just have to choose where you're going to be on that conveyor belt to be able to. Many people, especially young people, worry about jobs. You know, and in a country like ours right now, it's a big factor. People say, oh, but nikifanya hii course hii iko na kazi kweli, na nikifanya hii iko na kazi kweli. What would you say to that?
My approach to that is, one, if, and I want to give an example before I respond to it. If today Kenya, God forbid, if today Kenya will go into war, is it necessary for us to have trained soldiers who are just sitting in the barracks waiting for that time? So essentially what I mean is that you must have the tools of trade, so that when an opportunity comes, then you'll be able.
You're ready.
You are ready to be employed. And I want to urge the youth that it's not an issue of white-collar jobs. In the medical field, if you do pharmacy, for instance, you can end up in the private sector. You can end up being an employer yourself by opening your pharmacy. You can employ others to support that. So there is no limitation. A number of KMTC graduates also end up in other countries where there are opportunities. In the US, there's high demand for nurses. Australia, UK, we have seen a lot of Kenyans going to those countries. And what we need to have as a country is just to have a structured way of having those exporting the human resource capital. So that, and again, if you look at the current state, is that the diaspora really contributes a lot to our economy. And most of them are in the medical field, apart from the other fields.
Yeah, true.
So in a nutshell is that you are better off when you have the tools of trade, so that you have an opportunity to apply. You can imagine if you sit and say, after all, there are no jobs, so what do you want to do? You sit at home. If an opportunity comes, it is the person who went to school
the one with the tools
that will be employed.
Yeah. In any case, people will not stop getting sick. That's a reality. We will be sick in 2020, in 2030, in 2050. There will still be sick people who will need help.
I agree with you. I mean, we cannot run away from
the reality.
The reality.
The human body.
Things keep on shifting. We deal with this. Some of the diseases we eradicate, the polios and the rest that are almost being eradicated and so on. But however, new challenges come. Who knew COVID will be here?
Who knew? True. And that we would wear masks
which
and
now come as a norm, sanitizers and so on. And when you look also at the way the lifestyles that we are currently living in, we get more exposed. Look even at the border menace in the country at the moment. A lot of accidents. It may not be directly a disease, but it's of course you need medical care at that level. So clearly, as you have put in, we'll need people in the area of medical,
Yeah.
across board.
Yeah, we have a few minutes, but let me just ask as we almost wind up. There are courses that are not taken so much that are required. Maybe you can just mention to us some of the things that you would like Kenyans to also just take a look at also these things as you take a look at the others, because we're always still thinking nursing, clinical medicine, pharmacy, we all want to, maybe occupational therapy. Are there things we miss out sometimes that you say these are necessary also? Please also look here.
Thank you for that. I think there are a number of courses which we, in most cases, we think we don't need them. Courses like medical engineering. If you look at medical engineering, all the equipments that we use in the health facilities, they must be maintained. And those are areas that there are opportunities. If you do a medical engineering, that diploma or a higher diploma in medical engineering, you can either work in the hospital, you can work in the industry, you can actually supply those equipments and maintain them. So there are opportunities in that area. You look at areas like new areas, radiology. I mean, it is the in thing now. You think of scanning, x-rays, those are the people that we need. So I know we have been thinking of clinical medicine and nursing and pharmacy. We have courses like optometry, which is also an area that people don't think is required, but we require in terms of our eyesight. We need people who will be able to deal with cataracts and so on. We do provide that opportunity at KMTC. Think of areas like health records and information technology. As we now move to technology, everything becomes electronic. We need these guys to be able to maintain the data in our health facilities. Those are still areas where we have opportunity and people may think we don't require. Medical laboratory sciences is still the key. We cannot talk of evidence-based medicine without somebody in the laboratory. So those are areas that we still have opportunities available where people can work into. Of course, we have now specialties, but that requires you that you must have done either clinical medicine or nursing, when now you think of specialized courses like nephrology and anesthesia. Of course, we still have opportunities, we have gaps, but you must have done something first. The areas like nutrition and dietetics, it is an area with the lifestyle diseases that are coming up, and most of this can be prevented by ensuring that we get the right nutrition. And if you look at our population, that's an area that will require advice from that team. So those are a few of
So
the
don't
areas.
just look at this, the
We should not
mainstream
focus, because, and that's why I'm saying, if you come to us, we'll be able to give you the right advice. You don't qualify for clinical medicine. These are the other options. If I do this, what will be my benefit? What are the opportunities there? We'll give you that advice, and then you make the right choice.
Yeah, because we want to believe everyone who wants to try and do medicine already has a heart for service. So if it places you anywhere, even if you're in the lab, it is service.
It is.
Yeah. What would be your word of advice to students who are watching you this morning and, just looking to see, and parents, of course, who are also looking to see what do I do, what's the next way forward, in terms of medical field? What would be the last word about your parting shot to them?
Thank you very much to our guardians, parents, and prospective students. I want to ask you to kindly visit our website, www.kmtc.ac.ke, and you'll get more information. We'll give you the right advice. You'll not have made a wrong choice to join KMTC. And for us, is that we train for better health. Thank you very much.
Thank you so much. I appreciate you taking your time and coming to our studios.
Thank you very much.
And we look forward to a time when we can also come out there and see what is happening in the colleges.
Yes.
Thank you so much. Professor Michael KIPTOO, CEO, Kenya Medical Training College. Very apt information there on how you can go about, achieving your medical dream. Whether you qualified for university or not, you can start from certificate, you can go to diploma, higher diploma, you can even get to a degree level, and even you can get all the way to PhD. The sky is really the limit, and you know the paths are still there to achieving your dream. So, as he said, go to their website www.kmtc.ac.ke. AC.ke. That's what I was missing. And see what is out there and what's in store for you. That's 59 minutes for this morning. Have a wonderful, wonderful day. God bless you, and stay tuned for Leah coming up with you also soon. See you tomorrow.